Okay, continuing with reproductive and endocrine basic anatomy, let's zoom in here on the adrenal gland. Remember adrenal at the kidney. And it has both a cortex and medulla, and we've seen those words so many times now. Cortex, again, Greek root word, the bark of a tree. So on many organs, like on the brain, the cerebrum, the cerebral cortex. So the cortex is the outer layer. Medulla means the marrow or the core. So the medulla is the inner part. And this is an important distinction because completely different hormones come from the adrenal cortex and from the adrenal medulla. And let's then take a look here. So the adrenal cortex, composed of three regions: the zona glomerulosa, the zona fasciculata, and the zona reticularis. And I'm going to suggest that you notice that the regions start with the letters G, F, and R. Remember, that was like in the kidney, in the nephron, the glomerular filtration rate. So this doesn't have anything to do with that, but nonetheless, GFR. That's an easy thing to remember. I'm going to tell you to remember GFR, salt, sugar, sex. GFR, salt, sugar, sex. GFR, salt, sugar, sex. If we were in class, I would have one side of the classroom go GFR, and then the other side would go salt, sugar, sex. It's so exciting when we do that. That's because completely different hormones come from these three regions, as we'll see in the physiology. Zona glomerulosa, salt, is aldosterone. Zona fasciculata, sugar, is cortisol. Zona reticularis, sex, they're really androgen precursors, but they eventually become the estrogens and testosterone, or the androgens. So notice here, don't mix this up. There's the outer connective tissue capsule. That's not part of that. That's just the outer lining of the kidney. Then we have the three regions of the cortex, and then underneath is the adrenal medulla. Now you know from Bio 201, adrenal medulla is where the catecholamines are released as part of the sympathetic response. Remember, the adrenal medulla is really like a sympathetic ganglion. Releases the epinephrine, norepinephrine, and dopamine. So the adrenal medulla is sitting underneath the adrenal cortex. The pancreas is an endocrine gland, also an exocrine gland, as we know already. We've been over that many times, and I hope you all finally got this straight. The pancreas, as an exocrine gland, releases the digestive enzymes into the duodenum. Remember, carboxypeptidase, well, it releases them in the zymogen form. But carboxypeptidase, trypsin, chymotrypsin, so those were the exocrine secretions. Endocrine secretions are insulin and glucagon. And remember, those are released into the blood, not into the duodenum. I hope everybody got that straight. People missed that on a quiz. A lot of people did. I hope that's now finally straight for you. Exocrine versus endocrine. Exocrine, digestive enzymes. Endocrine, hormones. Okay? So what we see here is in the pancreas, remember there were the acinar cells, the pancreatic acinar cells. Those are the ones that made the digestive enzymes. Then there are these little islands in the middle of all the acinar cells, and they're called islets. Islet, literally a little island, okay? So the acinar cells were the exocrine glands. They made the digestive enzymes. In the islets are the endocrine cells, all right? There are alpha cells, beta cells, and delta cells. So here's the way that I'm going to have you remember this, okay? There are more beta cells than anything else, even though it doesn't really look like that in this diagram necessarily. There are mostly beta cells, and beta cells secrete insulin. Alpha cells are the second most common. They secrete glucagon. And delta cells are the least common. They secrete somatostatin. Somato, body, statin, the same. Somatostatin tells your body to stay the same. So somatostatin, which by the way is the same as growth hormone inhibiting hormone, it tells the alpha and beta cells, don't do anything. We're copacetic, all right? Everything's okay. Don't release no insulin, don't release no glucagon. Everything is fine. So that's what the delta cells are for, and the somatostatin. Let's go back and start looking at a little more detail here in the reproductive anatomy for the male this time. So the urinary bladder, again, we should be familiar with that. The vas deferens. The vas deferens, also called the ductus deferens, either term is okay. That's what transports sperm from the testis and eventually allows it to exit through the penis. All right, so it's a sperm transport tube, the vas deferens. That's when you get a vasectomy, they snip that so that the sperm can't get out. They're trapped inside. The prostate, again, the gland that sits right underneath the urinary bladder. The prostatic secretes some fluid that makes up semen, and we'll talk about that more later. The bulbourethral gland. The bulbourethral gland, it used to be called the Cowper's gland, sits at the base of the penis. This secretes a lubricating fluid that in the vernacular is sometimes called pre-cum, because it's not actually semen. It comes out before semen. It comes out during sexual arousal. The purpose of the fluid of the bulbourethral gland is to lubricate the glands of the penis to make penetration easier, all right? Because as we all know, lubrication is essential to make this work. So that's the purpose of bulbourethral fluid. Now, everybody, I get this question every semester, can you get pregnant from pre-cum? Well, look, bulbourethral gland has no sperm in it, okay? So there's nothing you can get pregnant from in there. However, it's possible. If, for example, you're going for round 2, if you're going for a mulligan, all right, here, there could be semen still trapped in the penis, all right? And so when the bulbourethral gland starts secreting a second time, it may wash out some of the previously trapped semen, which includes sperm. And so in that case, yes, you could. But you're not getting pregnant from bulbourethral fluid itself. You're only getting pregnant from sperm, okay? I hope that's clear. The spongy urethra, we mentioned that before, that runs through the tissue called the corpus spongiosum. That's where the urethra runs, all right? Penis, the external organ. Corpus spongiosum, again, is the tissue. The glans penis is the little fireman's hat on the end of the penis, all right? The little fireman, we all know about that. The prepuce is the foreskin, unofficially called foreskin. We need to know the technical term. It is the prepuce, and both males and females have it, as we'll see coming up. The external urethral orifice, that is how both urine and semen leave the body. The testis, again, is the organ that produces sperm. The scrotum is the little sac that holds the testis. The epididymis looks like a little caterpillar that sits on top of the testis. The epididymis is where sperm can be stored for a month or something like that. I don't know exactly. I don't know if anybody does. But you never know when you're going to have a sperm emergency, and you need some right now, and you ain't got time to make it in real time. So the epididymis can store the sperm. During ejaculation, you're not ejecting sperm in real time. You're ejecting stored sperm coming from the epididymis, traveling through the vas deferens, and then leaving through the external urethral orifice. The ampulla of the vas deferens, so what's happening here is let's put all this up here together, all right? So the seminal vesicle is that little vesicle, that little structure, you can see it labeled there on the diagram, that sits sort of in between the prostate and the urinary bladder. So here's what happens. The vas deferens transports sperm from the testis, and it goes into the seminal vesicle. The seminal vesicle makes seminal fluid, and the sperm then joins with the seminal fluid. They then enter into the prostate through the ejaculatory duct, all right? So the ejaculatory duct carries both sperm, and it also carries seminal fluid, so there are 2 fluids already. Then the prostate adds a third fluid, prostatic fluid, and those 3 fluids together make semen. Semen is what is ejaculated, but semen is composed of 3 fluids: prostatic fluid, seminal fluid, and sperm, okay? And then I think that's it. We talked before about the membranous urethra and the prostatic urethra and the spongy urethra. The ampulla of the vas deferens then, when the when the seminal vesicle comes together with the ejaculatory duct, you get a wide spot there, and we've seen this. We've seen the word ampulla used so many times. The ampulla is the wide spot where the two tubes come together. It's so simple. The same terms over and over and over again. Okay. Then looking here at a coronal or frontal section here, with this poor guy just had his penis chopped off. Apparently, Lorena Bobbitt's husband. You probably don't know who that is. It's okay. So the spermatic cord is the big giant bundle that leaves the testis. So deep inside of the spermatic cord is the vas deferens, but the spermatic cord is composed of other things as well. And let's just put all these up here at the same time, all right? So the cremaster muscle is a muscle that lines the entire, so the spermatic cord is the entire structure composed of 3 subsections. The cremaster muscle is a muscle that goes down and surrounds the testis. This allows the testis to be raised or lowered. As we'll see, sperm production is temperature dependent. So the male body has to have a way of controlling the temperature of the testis. So by either, in cold weather, you pull the boys right up next to the abdomen to keep them warm. Whereas if it's really hot, you let them dangle in the breeze, okay? The cremaster muscle raises and lowers the testis. The vas deferens then is the tube very deep inside that carries the sperm. And the pampiniform plexus, remember plexus, we've seen this all the way back to 201, comes from the Greek word meaning a braid or a tangle. So notice all the blood vessels, the artery and the vein there. That's called the pampiniform plexus. That's also important in controlling temperature. It uses counter-current exchange mechanism, all right? So that's the spermatic cord, right? The epididymis, again, is a little caterpillar on top of the testis where sperm can be stored. The scrotal septum is the divider. Remember septum? We've seen the nasal septum. Septum means a divider. This is what you need to keep the boys separate. You don't want them boys coming into contact with each other, so you have a scrotal septum. It's possible to get testicular torsion where the boys get tangled up. And that happened to a former student of mine, her brother, that happened to him, and one of his testes turned black and swelled up to like the size of a racquetball, and they had to just cut that boy off. But fortunately, males got 2 testes, just like an F-15 has 2 engines, One fails, the other one will get you home, all right? Have to have a testis removed, that's okay. The other one can take over, still be able to produce those little parasites. Corpora cavernosa and spongy urethra and corpus spongiosum. So look at the severed penis there. God, that's painful to look at. Notice there are 3 tissue compartments. It looks like a little face going like, oh my God, I've been cut off. So the 2 little ovals on the top, those are the corpora cavernosa. Individually, it's the corpus cavernosum, each one individually, corpus cavernosum, the 2 together, corpora cavernosa. Those are erectile tissue. And then down at the bottom is the corpus spongiosum. That's also erectile tissue. That also then houses the spongy or penile urethra. The little circles in the corpora cavernosa are blood vessels in order to allow the engorgement of blood into the penis. That causes erection. I hope you realize that even though they call it a boner, there's no actual bone in there. There is in the aquatic mammals, and even in a lot of the terrestrial mammals as well. I think all the procyonids have a penis bone, the raccoons and things like that. But in male humans, there's no bone. That's just blood that's engorging the penis and making it firm, okay? And then the tunica albuginea. Tunica basically is like what knights wore under their armor. It's essentially a shirt. Albu, root word, means white, so the tunica albuginea is the white shirt. All right, the white shirt. That is a layer of tissue that surrounds the testis, okay? So you can see it labeled there, the tunica albuginea. There's also the tunica vaginalis, which is part of the peritoneum, but I don't have that on your sheet because normally the models and the charts we have in the classroom don't show that very well. So I do want you to know the corpus, or the tunica albuginea. I don't require you to know the tunica vaginalis, even though it does show up clearly here on the diagram. And then the dartos muscle, this is a muscle that lines the scrotum. So this is yet another mechanism whereby we try to control temperature of the testes. So when the dartos muscle contracts, it causes the scrotum to shrivel up and pull the testes closer to the abdomen to keep them warm. If you ever watch a male naked getting out of cold water, you can see that that thing is all shriveled up. Go next time you're at the beach. Watch for that. You see little boys getting out of the ocean. Don't look too closely. Somebody will dial 911. But you can see that males, that the scrotum will shrivel up. Okay, so the sperm, the little swimmers, that's what make the little parasite. So 3 parts shouldn't be too complicated here. I mean, come on, head, middle piece, tail. All right, can it get any simpler than that? I don't think so. Okay, that's all you have to know. So here we are, male anatomy here, reproductive anatomy. This is a really good view, and I want you to make sure you know this view well. I use this. We had a great model that I used that showed this view, and it's a good view of a lot of structures all together here. So I'm going to put all these words up here so that as my brain hits them in random order, you'll have a word there corresponding to it. So notice the urinary bladder, and then see how there are 2 tubes up there near the top? Don't mix those up. They're very different. One is the ureter coming down from the kidney, bringing urine to the bladder. The other one is not going into the bladder, it's going around the bladder. That is the vas deferens or ductus deferens. This is carrying sperm. So notice as the vas deferens approaches the seminal vesicle, it gets wider. That's the ampulla. We've seen ampulla so many times. It's the wide spot. We saw the hepatopancreatic ampulla. We saw the ampulla of the semicircular canals in the ear. Ampulla means a wide spot, basically. So notice the vas deferens has the ampulla right where it joins the seminal vesicle. Vas deferens is carrying sperm. The seminal vesicle is producing seminal fluid. So those two come together to form the ejaculatory duct, and that goes into the prostate. The prostate then adds its own prostatic fluid, and we now have semen, which is composed of 3 fluids, all right? Sperm, seminal fluid, and prostatic fluid. From there, they pass through they pass through the prostatic urethra. Prostatic urethra is carrying both sperm and urine, all right? And then the membranous urethra, and then finally the spongy or penile urethra. There at the base of the penis, we see the bulbourethral or Cowper's glands again, which are producing the lubricating fluid. And then coming down into the penis, there are the corpora cavernosa and the corpus spongiosum, which we've already talked about a little bit before. So I think that's about it for that slide. I think everything there is pretty clear. Let's move on. Another view here of some of the same structures. So let's take a look. Put all the terms up here again. So we see the internal urethral orifice. That's where urine leaves the urinary bladder. From there it passes through the prostatic urethra, then through the membranous urethra, then through the spongy or penile urethra, before leaving through the external urethral orifice. Okay, there are the bulbourethral glands again, producing a lubricating fluid. Down at the bottom we see the glands again, the little fireman's helmet, all right, and the prepuce, again the foreskin, which covers the glands. Males who have been circumcised, that's what they remove, is the prepuce. And there's been controversy about that in past years. I think now the consensus is that there's not really any reason to circumcise. I'm not sure that's really bad. You decide. That's your decision. During erection of the penis, as the penis enlarges, the prepuce will naturally pull back. So it doesn't interfere with sex in any way. So it's really, I don't know. You decide. It's a personal decision. All right, looking now at some more female reproductive anatomy. Again, I'm going to put all these terms up here so that as my brain hits them in random order, we'll still get to them. So notice we have the uterus sitting there on top of the urinary bladder, all right? Then at the base of the uterus, well, the uterus has different regions, okay? And I don't see all of them on this slide, but that's okay. The very top of the uterus is called the fundus, all right, which we've seen before. We've seen fundus a few times. So the fundus is the dome-shaped segment on top. Then there's the body of the uterus, and then the neck of the uterus is called the cervix, and that makes sense because you know your spine, the cervix, the neck. So the neck of the uterus is the cervix of the uterus, all right? And then that opens into the vagina. The vagina is actually the entire organ. The vagina consists of tissue, and then the space inside is actually the vaginal cavity. So, but the vagina is an organ, all right? The vagina then opens outwards through the vaginal orifice, whereas the urethra opens at the external urethral orifice. Okay, and then females have two sets of labia. Labia means lip. So there are two sets of lips. The labia minor are the innermost labia. Those don't have hair. The labia major, the outer labia, those do have hair. Of course, unless you've gotten your Brazilian wax, then they don't. Then further up, notice on above the anterior to the pubic symphysis, there's a lot of adipose there. That whole area is called the mons pubis, and that's normally there's hair up there. Sometimes even if they're Brazilian wax, you leave the landing strip, as they call it. So all of that region would have hair. So the mons pubis, literally the pubic mountain. So isn't that a wonderful name? Then we can see here we have the uterine tube. Used to be called the fallopian tube. It's now the uterine tube. The uterine tube is what's going to transport the egg, the ovum, from the ovary into the uterus, okay? So notice at the end of the uterine tube, there's a little spread out area there on top of the ovary called the fimbriae. That's basically a catcher's mitt is what it is. There's actually a little gap in there. So when the ovum is released, you hope that the fimbriae catch it. You hope that the catcher's mitt catches the ovum and then transports it through the uterine tube into the uterus. Now, sometimes that doesn't happen. The catcher's mitt misses. You get a passed ball. It's the catcher's fault. That's E2. No, they don't make that an E, but it's still a passed ball. But in that case, it can be that if the ovum is fertilized, it can implant outside of the uterus. Then you have an ectopic pregnancy. That's not good. That's not going to work. So you hope that the catcher's mitt catches it and takes it in there. Now, the round ligament is a ligament that holds the uterus to the anterior abdominal wall. You don't want the uterus to be able to just flop around and go anywhere in there. So you try to hold it in place. And notice on the back side, there's the uterosacral ligament. That connects the uterus back towards the sacral part of the body. So, and there are going to be more ligaments as well. But notice those two are trying to hold the uterus in place so that there's some stability there in keeping all the anatomy in order and in place, okay? So take a look here, a superior view of a transverse section. You know exactly what that means. So here we can see some of those structures we've been talking about on the previous slides. We have now the uterine tube, all right, it used to be called the fallopian tube. Notice therefore you can see the round ligament, okay, and you can also see the uterosacral ligament, which is basically anchoring the uterus to the front and back of the body. There's also the broad ligament, all right? The broad ligament we're going to see in a different view. The broad ligament, why is it called the broad ligament? Because it's broad. It's a very wide ligament. We'll get a better view of that later. Then the suspensory ligament is yet another ligament that's holding the uterus in place. And I think once again we'll get a better view of that coming up on another slide. So here I think is our last slide. So let's put all this up here again and just kind of talk through it all as my brain randomly encounters it. So here now you see the broad ligament. The broad ligament is basically in between the ovarian ligament. The ovarian ligament anchors the ovary to the uterus, all right? Then we see the broad ligament, and then further down we can see the uterosacral ligament going backwards towards the sacral region. So broad ligament, big broad ligament, all right? I don't know what more to say about it than that. Let's take a close-up look here of the uterine tube. So we can see that there is the fundus of the uterus, that's the dome-shaped part on top. The first section of the uterine tube, well, here's what we're going to do. We're gonna make a deal here. The very first section is called the isthmus, which once again we've seen isthmus before. It's a little narrow part. Then we have the majority of the uterine tube, which we're going to call the ampulla because it's wide. Then when we get to the end, we have the infundibulum, a word we've seen before. That was how the pituitary hung off of the hypothalamus. And then from the infundibulum are the fimbriae, which look like little feathers or little fingers. So what we're going to do is if I mark the uterine tube right up by the fimbriae, we're going to say it's the infundibulum. If I mark it right by the uterus, we're going to say it's the isthmus. If I mark it out in the middle and nowhere, we're going to say that's the ampulla. Okay? The ampulla is the wide part out in the middle of nowhere. So that's the deal. Either right next to the uterus is the isthmus, right next to the fimbriae is the infundibulum, out in the middle is the ampulla. Now then, the uterus itself, three different kinds of tissue here. We have endometrium, myometrium, and parametrium. Peri, remember we've seen that prefix so many times, means around. So the parametrium goes around the outside of the uterus. Myo, muscle, the myometrium is the muscular tissue. That's what we're going to use to squeeze that little parasite out. And then the endometrium is the innermost layer. That's what's going to prepare the uterus for implantation. That's going to have a lot of vascular tissue there. That's part of what's going to, during the menstrual cycle, it'll be a lot of that is released. So the vagina has rugae. We've seen those before in the stomach and the bladder, again, in order to stretch out. That little parasite, oh my God, you got something the size of a softball that's got to get through an opening that's normally about the size of a pencil. So yeah, you got to be able to stretch that thing out. So notice where the vagina joins the uterus, that's the internal os. Os can mean bone or it can mean opening. In this case, it means opening. The external os is where the vagina exits then. Let me back up. So we have the uterine cavity. Where the uterine cavity joins the cervix is the internal os. Where the cervix joins the vagina is the external os. Okay, so basically the os are the openings of the cervix, internally to the uterine cavity, externally into the vagina. All right, so this is a good view. I know it's kind of complicated at first. Spend some time on this and try to get all this straight. This is a good structure, a good view. I'll probably use this in the lab practical.